I'm getting a lot of questions about waking up under anesthesia. Scary stuff, because if you're being cut open, you don't want to be awake to remember it or to feel the pain. Like, it's really scary, and that's what our job is to keep you guys asleep and safe during surgery so you don't have to feel that. So why are people saying that they remember what's going on under anesthesia or that they're waking up under anesthesia? Let's talk about it. I couldn't get enough time in the TikTok, so I just want to break it down here because there's a lot of nuances to it. Bottom line is that there's different types of anesthesia because there's different types of surgery out there. If you're having anesthesia for a colonoscopy, for example, or a pain injection, that's usually what we call sedation. So it's like something minor in the IV so that you're comfortable. You may or may not remember any of it, but you're not under general anesthesia by any means. You're just breathing on your own with an oxygen mask, and you're supposed to be interactive with the surgeon or whoever's doing the procedure. You're not fully asleep. So a lot of patients say, oh, I was awake for my colonoscopy, or I woke up in the middle of my colonoscopy. Well, it's kind of by design. You weren't supposed to be asleep in the first place. Then you have general anesthesia. You're typically fully asleep. You don't remember anything, and if somebody tries to wake you up, they can't wake you up because you're pretty much in a medically induced coma. General anesthesia is what we use for most of the big surgeries that you think of, like hip replacements, knee replacements, spine surgery, taking out your gallbladder, brain surgery, and all those things. Waking up under general anesthesia is pretty much impossible except for a couple rare scenarios. I can't say it's never happened because there are some niche scenarios that happen. It's not common though. The most likely cause of somebody actually, quote, waking up from anesthesia is if they're having an emergency. Think of you getting hit by a car, for example, and you're in the emergency room and you need to emergently have your abdomen opened or have a bone fixed, or if you're having a cesarean section emergently because the baby needs to come out now. Those are different because we can't give as much anesthesia as we typically would because in emergency situations, the rest of your body may not be healthy enough to tolerate general anesthesia. Those are some of the exceptions for when patients might remember something from anesthesia. Usually people remember some sounds. Personally, when I had my wisdom teeth taken out, I wasn't under general anesthesia, it was just sedation. I do remember hearing the drilling sounds. It wasn't uncomfortable, I wasn't in pain, but I could definitely remember hearing something. When patients do remember something from general anesthesia, it's usually something like I could hear the saw or I could hear some sort of drilling or something. Patients never wake up bolt upright in the middle of surgery unless something unusual has happened, like they're having an emergency or there's been a malfunction. If your body is getting general anesthesia, I'm not aware of any single human being on the planet who's ever lived who has been able to wake up or tolerate general anesthesia. There are people who have red hair who might be at higher risk of remembering things. We'll talk about that in a different video because people are asking me about that as well. I have a post on the website where I go into some of the data. Red-haired people are a little bit different, so we can talk about that as well. But for people, the normal person without any major medical problems, having an ordinary surgery, not an emergency surgery, not a cesarean section in emergency situations, the chance of you remembering anything is incredibly low. And if people have woken up in the middle of anesthesia, it's usually because they were under sedation in the first place and they were never fully asleep. Of course, waking up from anesthesia is a good thing because you don't want to be asleep for the rest of your life. So we got to discount people that say that as well in the comments. There's only one type of surgery that's not an emergency that some patients are at higher risk of remembering things from, and that's open heart surgery. The reason why is because it's similar to the emergency situations where we don't want to give you too much anesthesia because that can actually hurt your heart and the rest of your body. So we need to be a little bit more conservative with how much anesthesia we give, which thereby increases the risk of awareness. But overall, open heart surgeries are a very small number of all the surgeries that happen in the United States and in the world. So if you're the average person having the average surgery, the risk is very low. As always, you want to absolutely tell your doctor, your surgeon, your anesthesiologist about what medications you take, because people who use medications like antidepressants or anti-anxiety medications, or who drink alcohol on a daily basis, or use marijuana on a daily basis, or even a weekly basis, are all at higher risk of remembering things. So we don't want to scare anyone, but you do need to tell us what you do, and you have to be honest about it. A lot of patients try to hide these things from me, and it only hurts them in the end. You want to be open and honest about all the medications and any other supplements you take, before surgery in particular. And I want you to be reassured that unless you're a daily alcohol drinker or use marijuana every day, The risk of you remembering anything is incredibly low. And even if you do use those every day, we can give you medications to help minimize further the risk of remembering anything. We want you to be safe. And a lot of people might try to scare you or freak you out before surgery or anesthesia and try to sell you something to help you relax, like some weed, marijuana, whatever, Xanax, something to get you to calm the nerves. Well, a lot of that is just trying to make money off of you, and I don't like that when patients tell me that's what people have told them. It's not right to make money off of people who are afraid before surgery, especially when just knowing the truth about surgery and the truth about anesthesia can solve all those problems and help you feel better without the weed. I want you to be safe before surgery. Leave your questions below. Stay safe.